Hey, let's talk about ventricular hypertrophy when the heart gets a little bit too big for its own good. Because looking at that X-ray, that is a big heart. With ventricular hypertrophy on the EKG, we're going to be looking at the QRS complex because the QRS is ventricular depolarization, and it shows us the ventricle. So we're going to be focusing on this QRS complex, and our ventricles depolarize in a very distinct order. First, our interventricular septum depolarizes. Second, the main ventricle, and then third, kind of the basilar, kind of posterior, superior areas of that of the heart depolarize. We're going to go red, yellow, blue as one, two, three. And that's what it's going to look like in your heart. That's what it's going to look like on your EKG. So red is our first area of depolarization septum. Yellow is our second area, and then blue is our third area. So as we look through our different windows, we're seeing these different vectors, these different areas of depolarization at different times. So I'm looking at lead 2, and I've got this vector going this way. I see a little bit of positivity here. Main area of depolarization in yellow shoots it up, and then I've got that third area depolarization that creates an S wave. So we've got this very distinct progression of depolarization, and when we look at ventricular hypertrophy, we're looking at the ventricles. We're going to see differences in this, not necessarily the sequence, but the strength of those vectors and the kind of the size of those arrows and the size of our EKG waves. Same concept, just from the precordial leads. And this view here, this is the right ventricle. Here's your interventricular septum, and then here's your left ventricle. So, anatomic view of the heart, even though there's left ventricular dominance on our EKG. So, first area to depolarize is the interventricular septum. We're going to see that. So, we're looking through V1, or we're looking straight at it. We're going to have a little tiny little R wave. And then the main part, that second part, that yellow, we're going to have this big old negative deflection because it's going away from V1. And then the basilar part, that blue arrow, we're going to have another little, maybe a little humped bump right at the end. So same concept as your limb leads. We've just got different windows. We've got different views looking at the heart, and we're going to put all this together to get this like 3D view and see, well, you know what? If the left ventricle is hypertrophied, there's more muscle here, and this yellow arrow is going to be like really super big, right? So as we get into things, keep in mind the sequence of depolarization and how that affects what we see when we look out our windows, when we're looking through our electrodes. And here's a cool real-time view of depolarization. You see exactly how it flows through the ventricles. So from the atria down through the ventricles. So we depolarize the interventricular septum first, and then it spreads into our main ventricles and kind of on and around the posterior side. Looking at our EKG, at our QRS complexes, we're looking for a number of things. Height and width, or amplitude and duration of the QRS complex, is going to tell us a lot. We've already gone over bundle branch blocks, these wide QRS complexes. Now we're going to throw in maybe some height amplitude issues with QRS complexes. We're going to look at the morphology, just like with bundle branch blocks. In that right bundle branch block, you might have those bunny ears, that RSR prime. We're going to look at the morphology of them. We're going to throw in Q waves into this. So QRS complex starts with a Q, might start with a Q. Um, so are there Q waves, and are those Q waves interesting? Are they not? Are they concerning? Are they not? Are they normal or are they not? And then we've already talked about axis, and when we are determining axis and R wave progression, we're looking at our QRS complexes. So is axis normal, or is there something weird with axis? Is our R wave progression, our Z axis, is that normal? Or is there something off with our precordial R wave progression? As we get into this, as we get into ventricular hypertrophy, we're going to see some pretty tall complexes, some pretty deep complexes, so a lot of amplitude issues. And most common cause for that is ventricular hypertrophy, whether it be left or right, and we'll talk about that, but also abnormal pacers. So in this example, we've got this big old PVC right there. That's going to be like a rank, right, off the page. It's a lot bigger than the other ones, so it could be this abnormal pacing site. or an aberrantly conducted beat. So something just out of the ordinary, out of the normal. So we know that if we have these like really tall or really deep, these kind of big amplitude QRS complexes, there's something going on. There's something weird going on. There's something abnormal going on.